Cerebral palsy by Charlotte Taylor. Cerebral palsy is a group of disorders that affects a person's ability to move and maintain balance and posture. CP is caused by an abnormal brain development or damage as the brain develops, affecting a person's ability to control their muscles. Three types of cerebral palsy. The most common type being spastic, which affects 80% of patients. Spastic cerebral palsy affects all four extremities, the trunk and the face, with developmental disabilities including intellectual disabilities, seizures. These patients have complications with vision, hearing, and speech. Dyskinetic cerebral palsy. These patients have complications controlling their movements of their hands, their arms, and their feet and legs, making it extremely difficult to sit or walk. These movements are uncontrollable and can be slow or rapid and jerky. These patients often have complications with swallowing and speaking. The muscle tone can change not only from day to day, but multiple times in one single day. Ataxic cerebral palsy affects patients' balance and coordination complications. Quick movements that need a lot of control are difficult for these patients. Difficulty controlling their hand or arm when reaching for something. Often this type of cerebral palsy is noted as soon as the patients begin to grab for toys, such as a 4-month well check. High-risk population for cerebral palsy includes infants of mothers who have had infections during pregnancy, such as the flu or pneumonia, which result in high fevers. Preterm infants that weigh less than 5.5 pounds and are born earlier than 37 weeks are at greater risk for developing cerebral palsy. Infants born to mothers who have abnormal thyroid function and protein in the urine are at a greater risk for cerebral palsy as well. The incidence of cerebral palsy in the high-risk population is 8,000 to 10,000 new babies each year will develop some form of cerebral palsy. Cerebral palsy does not mean they cannot have a long life. These patients typically live a long life with early intervention. Referrals for physical therapy and other therapies give them the best quality of life. Pathophysiology of cerebral palsy. A brain injury that occurs before, during, or after birth. The injury affects the motor area of the brain's outer layer known as the cerebral cortex. Once it is damaged, regardless of how the damage occurs, it is not repairable. These patients will have a lifelong diagnosis of cerebral palsy. Signs and symptoms of cerebral palsy are often detected during a well check, as the providers look for developmental progress. They find the parents complaining that maybe a 4-month-old is not reaching for their toys, or a 7-month-old is not progressing with motor skills, such as the ability to sit, maybe crawl. Movements of the arms and legs are uncoordinated. Muscle tone may be tight or loose. Reflexes such as the palmar grasp may stay beyond the age at which they are typically gone. Diagnosing cerebral palsy at an early age is essential for the well-being of the children and their families. Diagnosing CP takes several steps. Developmental monitoring, such as developmental history, watching the child during the exam to see how he or she moves, to determine what maybe the parents are seeing. Often, a neurologist is the first referral, as they may suggest brain imaging such as X-ray or a CT, possibly an MRI. Genetic testing or metabolic testing may be completed as well. The diagnosis of cerebral palsy does not just have an impact on the patient, it impacts the family as a whole as well. Now their normal lifestyle has been turned upside down. They will have multiple doctor's appointments. They will have therapy. These go from monthly to weekly, depending on the severity of the diagnosis. These parents often become frustrated and angry, and it's even harder when they have other children at home, especially if they're younger, as the younger children do not understand what is going on. Why does this child that has cerebral palsy need more care? They often have questions that are unanswerable. These patients, as they grow older, have a lot of adapting to do. Often they end up in community homes if the parents cannot care for them any longer. They have issues with mobility, communication. They are at a high risk for abuse as they cannot report when something bad happens to them. The role of a nurse practitioner in diagnosing cerebral palsy. The well child exam must be completed thoroughly. Monitor what that child is doing. Look at those reflexes very well and listen closely to the mother as she tells you what she is seeing as she spends every day with this child. If any developmental delays are noted, send the referrals as soon as possible to physiatry, physical, occupational, and speech therapy, or a neurologist. Educate the parents on the expectations of the disease process. They will have questions on each well check. Be prepared to spend extra time with them to ensure that they are educated on what is to come. As this is a lifelong process, so is the education. The maternal history for baby C was a breech pregnancy resulting in an emergency C-section at 35 weeks. Baby C weighed 4.8 pounds. Mom reports having the flu during her third month of pregnancy with a fever of 102 for 2 days. Baby C presents for her 4-month well check. Mother reports inability to push up using her right arm. Baby C does not grab for toys with her right arm, and the mother reports she has noticed some jerking type movements from the right arm. Which form of cerebral palsy does baby C likely have? What would be the nurse practitioner's first step in treatment? And what education is essential for this parent?